pending patent in PCT, and an agreement contract with AHL.
Dear, the doctor said he will be trying a new cataract surgery ring on me. It's used in patients with diabetes like myself. Come, see it.
New small pupil expansion device with not aligned islets. In 2015, this new concept was produced by a 3D printer, won a prize in the innovative category in BRASCRS Film Festival, and was published. The concept of this ring received multiple refinements on design and materials until we reached our current version with small inferior islets to easily engage below the iris, larger superior islets to be better suited above the iris, two small hooks to produce more stability. Now, what is the best material? Resilience tests, breaking tests, and optical microscopy tests showed us that PMMA is the best material for this design. In this video, we observe the PMMA version production tests by the industry. And here the post-production quality control laboratory. The first half of the ring is inserted into the eye using a McPherson forceps. The other half is then rotated into the eye with a Sinskey hook. The hook is then used to insert the small central inferior island beneath the iris. The process is repeated for each inferior island. Connect the Sinskey hook to the superior islands to attach the hooks below the iris. Connect the Sinskey hook in the large superior island and rotate the ring to the anterior chamber. With the ring near to the main incision, use a McPherson forceps to remove it from the eye. Following our success with the first tests, we started a new study to evaluate the ring efficacy. This paper won the best prize of the session in ASCRS 2017. Is the new ring stable during the surgery? The ring remained stable throughout 29 out of 30 surgeries. In these examples, we can see its stability during concurring, irrigation aspiration, in posterior capsular hexis, in posterior capsular rupture, with the IOL pressure the ring, This is a patient with total pupillary seclusion due to a Harada uveitis. A pupilloplasty was carried before insertion of the ring. We can see the appearance of a pupil after the surgery. This is a patient with relative anterior microphthalmos syndrome. You can observe that he displays a microcornea with a white diameter of 9 mm. Notice how the ring practically occupies the entire anterior chamber. For that reason, we did an inverse engage. The mean pupil circumference and diameter returns to a similar size around 1 month after surgery, as it is possible to see in the chart and in the many pre, intra, and postoperative. Only 2 mild bleedings in the cameral angle were observed during ring removal, due to the stabilizing hook touches during removal. However, in Maliang ring paper on the 30 consecutive cases, 2 mild bleedings were also reported. The ring seems to be effective at expanding and maintaining expansions of small pupils and pupils with synechia undergoing cataract surgery without risk of disengagement. Absence of control group. Large-scale studies are required to provide additional support for these study observations. After finishing this paper, what is the best iris expansion ring? We have collected data from 74 surgeries using 5 different rings. The rings with sulcus and aligned idents having a vertical height between 0.7 and 0.9 millimeters, in comparison to the 0.4 millimeters of the new ring. Meliung ring, MST, is the most traditional and most tested ring available in the market. It is very safe and popular, but as you can see, it is not possible to insert in colobomas and sectorial iris traumas, because it needs 4 points of engagement to the iris. Meanwhile, the new ring displays a 60 degrees opening in one end. This is another coloboma case. As you can see, the ring is stable during the surgery. In the eye ring, as well as in Oasis ring, there is a small hole as compared to Meliung ring. Such feature makes it easier to manipulate these rings. However, their material is less resilient than the new ring. Because of that, it is easier to insert this new PMMA ring in pupils with synechia. Expand and BRASCRS are the largest pupil expansion device in the market. However, as we can see, they also appear to be difficult to place in pupils with synechia. Conclusions about the best ring. With our current studies, we cannot make such a strong statement yet. However, as of now, we can already say that each ring has its advantages and that the new expansion ring emerges as a new option, especially to patients with coloboma and intense pupillary fibrosis.